Much appreciated, Vasiti. Thank you so much. And again, for speaking about the critical role that national disaster and management authorities on the ground, the critical role that they play in leading and coordinating response, preparedness and response efforts on the ground. And again, thanks so much for highlighting the work that you do in terms of communicating with possibly affected communities prior to a disaster to make sure that we minimize loss of life and suffering, the critical work that you play in coordinating efforts of NGOs and the private sector, because there's a wealth of knowledge and expertise within communities, within countries, and to ensure a more robust response, building on again these technical skills, capacities, and resources that other stakeholders offer. And again, it speaks to the critical work and the importance of local knowledge and understanding of the specific needs of affected people. And that's why, again, the specific examples that you've mentioned around how you communicate with affected people, better understanding their specific needs depending on context, and that's the point that also came out in the ODI report. AAP, it really is very context specific. This again is clearly quite important and critical to make sure that we have a robust and tailored response that is inclusive of affected people. So thank you so much again, Vasiti, for your points, and I'm sure we are going to come back to you again with questions and comments that will be coming from colleagues online. But maybe with that, I'd like to turn to Nanette. Nanette, again, is Executive Director of ECOWEB in the Philippines. So Nanette, there is a very dynamic civil society in the Philippines. So from your position of leading one of these civil society organizations, what has been your experience in engaging on the AAP agenda? And what have been the main challenges that you think we should prioritize and address as a community? So over to you, please, Nanette.
Thank you, Mervat. And good afternoon, good day, everyone from the Philippines. Well, in our country, I could say there's already a high level commitment among civil society to accountability to the affected population. There are a number of approaches having been employed already by various organizations. And in our organization, ECOWEB and ClearNet, for example, we do promote the approach called Survivor and Community-Led Response to Crisis Approach, or we call SELR. And let me share briefly about this approach. So this approach is helping crisis-affected communities rapidly analyze their own situations, identify ideas and opportunities for holistic self-help. The approach recognizes that crisis-affected people are not victims, but survivors, and that communities are not homogeneous. They are women, men, younger, older, different ethnicities, religions, with varying capacities, as well as vulnerabilities, with different levels of power, with capacities to all get involved. And this approach is helping crisis-affected communities to rapidly turn opportunities for increased self-help into action, like using rapid microgrants and other rapid capacity development, such as skills training and linking that transcend humanitarian and development divide. This ensures timely and relevant support to needs of the crisis affected through a process that strengthens their existing capacities. It is using local peer group or social mechanisms to maximize accountability. Accountability that is not only upward, but also downward and sideward accountability. It is using appropriate coordination also to ensure external actors to fill in the gaps, like, of course, government and other aid agencies, and to support the needs that cannot be met by this self-help mechanism. This is done as well by to empower also crisis-affected communities to link and represent themselves in engaging the government and other agencies. And finally, this approach also supports initiatives of self-help groups to initiate in finding durable solutions to their condition and address root causes of their vulnerability in a process that does not harm and thus ensures sensitivity to culture and context. After about 5 years of implementing this approach in different disaster contexts, we and other local organizations have already demonstrated, we could say that it works, and this is AAP in action. But despite the evidences, we and others have demonstrated, and it's not only ACLR, no? There are other approaches as well. But still, we could say that support for this kind of approach for scaling up and institutionalization is still limited. I wish to support the findings of ODI in their study, you know, that I see as a real challenge. And I would like to highlight the challenge of lack of dedicated multi-year funding beyond pilot approach, and somehow the lack of commitment to AAP by big funding agencies. The funding that we have mobilized so far or helped us implement the approach, we're still mainly from small agencies having more flexible systems. I would say that AAP agenda may only be realized if commitment to AAP is turned into concrete action and change in systems, practices, and mechanisms within major humanitarian players, especially among donors and international agencies. There are already initiatives on the ground that just need institutionalized support for scaling up. The humanitarian actors just need to listen to the people affected of crises and support more local actors already doing AAP on the ground. Thank you. Back to you, Mervat.
Huge thanks, Nanette, and thank you for, again, underscoring that there are good examples of AAP being conducted on the ground by local actors that need the spotlight, need the resourcing, and need to be scaled up. This is such an important point, and thank you so much again for highlighting the ACLR, if I'm not mistaken, the right acronym approach that's being taken or that you're applying in the Philippines through ECOWEB. And again, that critical point that you've raised around linking analysis, and I'm really revealing around how you allow, or you not allow, but you enable or you create the platform for affected people to rapidly analyze their own situation, and how you use this information to really tailor the specific response that is needed by affected people. So thank you for talking also about inclusion and diversity, which are also quite critical pillars with regards to AAP. So thanks again, Nanette. And with that, I'd like to turn to Emanuele. Emanuele, once again, is the Director for Health and Care at IFRC. Welcome again, Emanuele. So this past year has seen an unprecedented demand for community engagement across the world, largely in response to the COVID-19 pandemic. IFRC is specifically co-leading with WHO and UNICEF the risk communication and community engagement pillar of the COVID-19 response, in particular with this establishment of a collective service for RCCE, Risk Communication and Community Engagement Coordination. So Emanuele, it would be really good to know what you think are the key lessons from the past year that can benefit humanitarian and public health responses in the future. So especially in terms of rolling out the RCCE coordination approach, this collective service, what are the main lessons learned that can inform future public health response efforts? And do you think that it can enable shifts towards greater accountability to affected people? So that's sort of linking that particular tool or approach to the larger agenda around AAP. So maybe with that, Emanuele, over to you.
Thank you very much, Mervat, and greetings from Geneva to all of you. Let me just start from the last words of Nanette that says we need to listen more. International organizations need to listen more. I think the collective service was born last year on a series of failures over time to truly prioritize social accountability and engagement of communities during previous emergencies, and it was born on some failures that we had experienced in Ebola, for instance, in West Africa and in the Democratic Republic of Congo. And what we were living at the beginning of 2020 was, and we are still living, was a massive crisis of disinformation around COVID-19 that needed a response that would bring partners together, coherent, to assess misinformation, but also to respond to what is underlying misinformation, which is trust, a lack of trust in institutions. So a number of organizations came together, WHO, UNICEF, and IFRC, to build this collective service for risk communication and community engagement, bringing these two critical elements together to support a more coherent response around these two areas in COVID-19, with an initial focus on African countries, but clearly a global intention of operating. So the risk communication collective and community engagement collective service has been in place for a year, and I think we have a number of lessons that we have already learned. And first is that during emergencies you need to act fast, but you need to act locally, and we have learned this in a way that is very different. I think the times of organizations flying experts into context has been very much challenged. The response has been local and thankfully so, and very strong. It needs to be contextualized. We often talked also in Ebola and DRC, they need to be hyper-contextualized, in the sense that we really need to understand the communities and have, and communities may differ also within a few kilometers from each other. So this element of contextualization of the response, or hyper-contextualization, is absolutely critical. The second lessons learned is that we really need to break silences, and we need to break silences at various levels. We need to break institutional silences and bringing partners together. As we say, it's IFRC, it's WHO, it's UNICEF, but the collective service has an ambition to go well beyond these agencies and bring in actors that are involved in risk communication and community engagement all over the world. And that's an important silence that needs to be broken. But also we need to break the silences between the health community that I somehow represent, the humanitarian community, the development community, and we need to speak a language that is similar when we talk about accountability, social accountability, community engagement, and risk communication, and adopt frameworks that can be similar, and accountability that can really be present across various sectors. Another important lesson, then, for me, is a critical one, is that social and behavioral sciences, and allow me to be a little bit provocative here, are not fluffy sciences. They are absolutely core when you talk about epidemics and pandemics. For many years, we have seen the biomedical interventions coming down as the thing that will sort out issues. We saw in Ebola, we saw in COVID-19 that having a vaccine does not equal to vaccinate people. That you have vaccinations because people don't trust the institution, don't trust the politician, they don't trust the scientists, they don't trust the media. We have learned that mistrust costs lives, and we have seen it in attacks to Red Cross volunteers in Ebola, or we have seen it in people that are refusing to get vaccines because they don't believe in that. And bringing up the data about what is happening on the social side is critical, and the community, the RCC collective service is really investing a lot in bringing evidence, bringing data, systematization, and visualization of the perception at the community level, so that we can work at the programmatic level on incorporating these perceptions and transforming into better programming that bring better results. And I think one element that needs to come into this is the consistent evaluation of the satisfaction of the people that we are trying to serve. They need to be driving the response, and we need to be able to assess better whether the services that are being provided are of good quality and meeting the needs. And I think 2020, and I'm concluding just with this point, has been a year of massive transformation that has brought this issue of localization and accountability at the very core of the work in health crisis, but well beyond of humanitarian workers. And this is something that will grow with time. and organization will be challenged on the way they really respond to the needs in a way that was not there, I think, before, and donors behind it will notice. So it's a massive wake-up call, and I think it's a moment, COVID-19, that can really move this agenda forward in a way that has not been happening before. And I hope that all together, and the collective service is one of the tools to that, we can move that in that direction. And I will put the link to the collective service in the chat if you want to have a look at the end of this discussion. Thank you very much, Mervat.
Thank you so much, Emanuele, and thanks also for highlighting some of the benefits, and maybe this is the inappropriate word, but with COVID-19, this is an opportunity for us to work towards the transformative shifts and changes in AAP that we all desire. So thanks so much for talking to us about the RCCE, collective RCCE approach that UNICEF, IFRC, and WHO are leading on. And as you've mentioned, this is for the system, and it's not just for the three organizations. And you've highlighted some really sobering also points around the importance of community trust. So a lack of trust in institutions or in science, or how we speak about the science, cost lives, and cost lives of vulnerable, cost lives of humanitarian workers that are the frontline serving vulnerable people. You also spoke about, again, striking that balance between acting fast, but also being accountable and acting locally. It's not either or, and it's not sequential. It can happen, and it should happen, at the same time. I also appreciate what you mentioned around the contextualization of the response. And again, that speaks honestly, bottom line, to the importance of localization. We will be context specific if we rely more and engage more with local actors, not only in terms of delivering humanitarian response, but really having a seat and having that meaningful engagement of local actors in decisions with affected people on what is best to meet the needs of populations on the ground. And then last but not least, that critical point around breaking silos. In the system, we've spoken a lot in the past around humanitarian development collaboration and linkages to peace. Of course, the COVID-19 response to the pandemic has really added a critical lens and an element on the importance of breaking the silos that you mentioned, Emanuele, between health, humanitarian, and development, and other key actors, to make sure that we're joining up our efforts and force to act in a joined up and a coordinated and efficient manner. So thanks a lot again, Emanuele, for these points. And with that, I'd like to turn to Kristen. Kristen Knutson is the head of the Office for the Coordination of Humanitarian Affairs Office, OCHA's office in Burkina Faso. Burkina Faso is one of the countries demonstrating a strong commitment to and implementation of a collective AAP approach. So that's actually exciting, and there's a lot, I'm sure, to hear and learn from you, Kristen, on this. So you're charged with coordinating a response in a complex emergency. So it'd be great, Kristen, to hear your views on what have been the factors that are essential, or the main ingredients that are essential to make this happen, and what have been some of the obstacles that you were able to work around. So over to you, please, Kristen, with your thoughts.
Great. Thanks, Mervat. I hope you guys can hear me well. It's a pleasure to be here today and to have this opportunity to reflect on what we're trying to do and what we have been able to do and what we next need to do in Burkina Faso. I'll start by noting I'm not going to be able to go over the full context of our complex emergency this morning, but when I arrived in mid-2019, which was also the point at which OCHA opened our office here, the humanitarian community was really just coming into being. There was a hard press to really expedite the transition from previously quite stable development context to a humanitarian footing in what became, in the course of 2019, the fastest growing displacement crisis in the world due to violence, insecurity, and the actions of non-state armed groups, where they were ongoing, and there was initial and immediate recognition of the value of community engagement and accountability work, but where they were ongoing, this work was quite diffuse. Organization-specific initiatives, I would say, predominated, particularly in terms of communicating with communities, using still C4D approaches, and also I would say a diagnosis that many of our partners were looking at prioritizing their corporate model to be rolled out, and we needed to look at more context-specific, context-appropriate work together. For instance, where we have gotten quite consistent feedback from communities across different mechanisms is that there's a strong preference for face-to-face feedback opportunities, and that technology-focused models are not particularly useful in context. Smartphones themselves can constitute a security risk for populations. There's high illiteracy, high technology illiteracy, and low access to technology, particularly in rural areas and amongst women, girls, marginalized groups. I think that one of our key facilitators from the beginning has been high-level engagement by the humanitarian coordinator and by heads of organization, if I can say so, by OCHA, to prioritize collective approaches to community engagement and accountability and start to tackle this idea of how do we build on what is already existent to create more complementarity and more coherence, and address weaknesses in the response. Not least among these weaknesses, the fact that international humanitarian partners promises and what we are delivering is simply not well understood, or was not well understood in a country by a government and by its people who were facing an unprecedented situation, didn't have familiarity with how the humanitarian machine works, but do have a strong, if increasing, incredibly recent as well, tradition of demanding accountability from their leadership. So we have that as one key facilitator. I would say a second key facilitator has been the fact that we have specifically looked at community engagement as a good in and of itself, as a commitment in delivering on our AAP global commitments, but also as a core component of our access strategy. In a very volatile environment, in the face of shrinking humanitarian space, with non-state actors targeting state efforts to provide basic services to the population, increasing community acceptance for humanitarian action based on engaging with communities to explain what we're doing, how we do it, and how the humanitarian principles are not concepts. They're actually rules of the road for better humanitarian action, for populations to have access to services, and for humanitarian partners to access populations. Early on, and with the support of key funding opportunities, such as the Humanitarian to Humanitarian Network's window of funding for collective approaches and common services, at the end of 2019, we were able to leverage some key partnerships for the humanitarian community. We got CDAC network to actually work with OCHA to put coordinator on the ground, a dedicated capacity for coordination on the ground from early in 2020, and to provide a consistent approach to our efforts to build the Community Engagement and Accountability Working Group. We also, and based on a very early interest and buy-in from the whole humanitarian country team, have built a partnership with specialist organizations like Ground Truth Solutions, who are conducting community perception surveys on satisfaction with the humanitarian response for us. And we've been able to layer in other common services. We have REACH working with us on multi-sectoral needs assessments, which have a broader national remit as opposed to the specific focus on affected communities of GTS. And so by looking at how the questions that they're asking can actually be coordinated from the outset, we've been able to enrich the feedback that we're collecting to inform analysis. We've also been able to really draw on other initiatives. And I think this speaks to what Oliver was saying about building on what's already there, and that common services are not enough to say collective approaches. We in 2020 had a significant amount of work in the context of the high-level panel on internal displacement with a lot of community focus group discussions. And we were able to draw in all of that feedback, but also use their mechanism for closing the loop to provide feedback to the communities about what we were hearing and what we were taking on board to inform the response. We're currently trying to do the same with the various community feedback mechanisms being supported by our equivalent of the camp coordination and camp management cluster. Looking at the framework that this has created for us with GTS support, not just in terms of doing the community perception surveys, but also a further engagement that they have made to support consolidated analysis of these various data streams to be able to have a richer understanding of what communities are actually saying to us. We've developed a set of AAP indicators that are in our HRP, but we've also got a common methodology now for continually analyzing and integrating into our periodic monitoring the feedback from communities. And then we have to keep moving and pressing into how we then are able to close that loop over and over in a consistent manner in terms of telling communities how we are actually responding to the feedback that they're providing. It's a lot of legwork. I noted that we are in a context where preference is face-to-face communication and no to low tech type modules. So we're also working at subnational level now to strengthen coordination and collective approaches to community-based agents and community-based networks as being means for communicating on behalf of us all with communities about our response. And I think we look ahead in the coming year, the coming months, hopefully, to another pilot in West Africa, which is the rollout of the regionally hosted pooled fund and the country envelopes that we hope will include Burkina Faso in short order to make it possible to put more funding directly to local actors for accountability. These are core commitments of our financing management strategy that we're putting forward for the Burkina Faso country envelope of the RHPF. That should help us support collective approaches at that last mile in terms of closing the feedback loop and sustaining it. So quick overview, I hope comprehensible about our key facilitators, some of our key obstacles in terms of just the sheer manpower that we need to keep mobilizing for these support and approaches. Over to you.
Thanks a lot, Kristen. And again, it's great to hear another, critical perspective, and hear the perspective of the UN and the role of the UN and the role of the Office for the Coordination of Humanitarian Affairs in mobilizing that collective approach and response to AAP. So great to hear about how the organization is using the country-based pool funds at the local level, which are at the disposal of the humanitarian coordinator and a committee at the field level or operational level to determine how funds are being dispersed for the response. And it's good to know that AAP is one critical element that is being looked at and how these funds are going to be dispersed. I can also say for certain that at the global level, we're looking at specific criteria or indicators in the disbursement of country-based pool funds. If AAP is not built into these mechanisms, then it will be more challenging to disperse these funds, in the future. So it's good to know that it's already being rolled out, on the ground. Thanks for also highlighting the importance of multi-sectoral needs assessment and how you've also capitalized or are looking at regular monitoring frameworks and how to look at the feedback being received to inform response and ensure that the corrective measures are in place to make sure that the response adjusts to the feedback that is being received. And again, reinforcing the point that came out also in the ODI report that Oliver spoke about, which is the leadership commitment. So with the humanitarian coordinator, the country representatives of UN agencies and NGOs that are part of the humanitarian country team and engaging with critical partners on the ground are absolutely essential. That leadership commitment at the country level, operation level, is absolutely important. So thanks so much again, Kristen, for the feedback and your intervention. Colleagues, we have a little over 20 minutes for questions and answers. I invite you, if you have any questions or comments, please do put them in the chat box. We already have a number that have come in, so maybe we'll just jump straight to this Q&A session, starting with a question to Nanette from Veronique. She is asking, Nanette, how in the survivor-led approach that you are implementing, how do you manage power dynamics in communities, patterns of exclusion and marginalization that exist in every community to ensure accountability is indeed for all, including where they may be entrenched social norms on gender, disability, or diverse sexual orientation? Perhaps, Nanette, this is a question for you, and while you consider the response, the next question is going to be for Vasiti, and it's a question from Ellie from TWB, specifically to the context in Fiji. In a multilingual context like Fiji, there are some sections of the population who speak marginalized languages. They may struggle to understand information or make their needs and concerns known if there isn't specific provision. So it'd be interesting to know if language is a component of the inclusive approach you are integrating into policy and legislative reviews, Vasiti. So let's start with these two questions, and then we'll take it from here. Over to you, please, Nanette.
Thank you, Mervat, and thank you, Veronique. Yeah, as I've mentioned, SLR approach is working with self-help groups in the community, and we consider that communities is not homogeneous, and that there are actually different groups in gender, and there is power dynamics, and thus actually the process really ensure that we provide opportunities for all. And so we work with existing and non-existing or new organizations or new groups, as the community so desires. So in our experience, for example, in some communities, like they decide that they would form like even 5, 7 to 10 groups. Like there is like a separate group for women, there is for farmers, there's for youth, and there's for men. And so it actually depends on the decision of the community and based also on their assessment of their needs. And so there are actually simultaneous actions being done by the community collectively and based on their decision. So it also based on context. So in indigenous peoples communities, for example, so they decide that it should be their traditional structure, but their traditional structure also ensures facilitates the inclusion of all and addressing the needs of everyone in the community. And we have seen that. And so we have to work with communities affected of crisis on site, and we have also worked with IDP, so displaced communities just know each other in their transitory shelter, but it works. So we have seen, although there are of course challenges, so this inclusion and exclusion issue, we are even saying through SLR approach, this kind of participatory approach, you are actually able to address this more effectively. And just would like also to mention that currently, we're actually conducting this localization dialogue for EP, OCHA, and Oxfam in the Philippines. And so one highlight actually with the focus group discussions with 25 communities affected of crisis, everybody actually expressed their first major recommendation is for humanitarian agencies to involve them in the planning, in the implementation, in the monitoring of the response and actions in the community. And this study we hope to share soon, and we're just like that. This is really like showing that people affected, they have actually capacities and they believe on their capacity. Thank you. I hope I have.
Yes, thank you.
Sorry,
still learning to find the buttons even after a year, doing this. Apologies. Many thanks again, Nanette, and just directly straight to Vasiti, please, on the question on the specific question on Fiji and speaking marginalized languages, two marginalized languages in Fiji before we move on, because I know we're very tight in time. We have a little over 15 minutes. So over to you, please, Vasiti.
Thank you very much. The simple answer to that question is yes. And I'd like to also make stress the point of governance. So in the emergency structure that we have during peacetime, we've got the respective ministries responsible for communication as well as indigenous language that supports the NDMO to translate public advisory, translate messaging out to the community. Now, during a response, because everything is happening almost instantaneously, we have the support of our partners. We're fortunate that with us we have CDAC in-house that assist us with the process of reaching out to translators to translate our situation report that advise the general public about the importance of the cyclone, when it's going to approach, and the response effort that the government is doing. So it's a two-way communication, and it's very, very important for us as disaster management to speak all language so that the communities are able to understand the message that's being pushed out, because our main agenda is saving lives. Thank you.
Thanks so much, Vasiti. Perhaps with that, we'll go straight to Oliver. So Oliver, a couple of questions. One is, how do we align with our commitment to include affected populations in the design and management of collective RCCE processes? That's the first question. And while I have you, and as you have the floor, another question from Smruti. It'd be great to hear how the AAP feedback from affected people have changed decisions or changed the response in a timely way. Over to you, please, Oliver.
Thanks very much. Both really good questions. On the sort of local leadership and involving local actors in the design of collective approaches, I think we've already heard some fantastic examples from both Nanette and Vasiti. I'll limit this to how people are involved in designing the collective approach specifically, rather than the wider question of participation of affected communities in decision-making and responses, which is a much bigger and thornier issue. But I guess there are both technical and political answers to this question. And what can be done is really going to depend on the type of response, and especially kind of the strength of the host government, whether it's a government-led response or an internationalized response. But a few possible options. At a really basic level, it could involve making sure that you have a good information ecosystem assessment, that you incorporating questions on how people want to be communicated with and how they want to give feedback into your needs assessments. Another clear thing you can do is actually make sure that local organizations are in the lead of the facilitation processes for these collectives, even if it's a more internationalized response, that it's not necessarily always, Oxfam or UNICEF running community engagement working groups, but it is a local organization in charge of that. Also, especially when there's a lot of partnering going on, trying to think of creative ways to bring sort of partner networks into dialogue with a more internationalized humanitarian response, which really can exclude local actors. So there was a fantastic example in DRC of, I think it was Caritas, sort of holding consultations with their faith-based networks and then feeding that into kind of international dialogues and international forums. And I guess at a more political level, especially in contexts where there's a strong natural hazard-related disaster management architecture of making sure that this really is a preparedness activity, and that the collective approach, finds ways to make sure that it's part of disaster preparedness plans that involve people's elected representatives fundamentally, and are part of a wider system of representative governance. So that's kind of from small to very large steps. But I'll leave that question. And then Smriti's point, the point I wanted to add on that is there are a lot of examples, but it's quite fragmented. And one of the things I didn't bring up in the presentation is collective approaches where they function need to do a better job of M&E around what they're doing. So making sure that they're documenting examples of when decisions change, because it does happen, but it's really easy to get lost in the mix, and there is barely any funding or resources available for actually collective approaches to monitor themselves. And I'm not necessarily talking about monitoring kind of the ultimate impact on populations, because that's a wider response issue, and it's causality is quite hard to prove, but being able to say, we brought this feedback in such a way that this decision was made can be documented much more clearly. I'll leave it there.
Thanks so much. Thanks so much, Oliver. I'm certain that we need actually, for a topic as rich and as important as this, and quite a diverse panel, we need another hour to cover all of the bases. But thank you for being brief and to the point. Maybe I'll turn now to Kristen Knudsen. A question from Veronique. One of the issues we had in the study on collective approaches to AAP at HPG was the lack of evidence of when collective approaches to AAP facilitate change in the humanitarian response. So any examples from Burkina Faso, Kristen, that you can share with us? And while I have you online, it would also be great to respond to another question. Response needs to adjust to feedback from the crisis-affected population. How do we ensure that projects don't deviate from donor targets or commitments, as this is usually one of the concerns of agencies? Any insights on this would be helpful. So over to you, please, Kristen.
Thanks, Mervat. Two very interesting questions. And I mean, I think I just want to start by really acknowledging Oliver's concluding point about we need to do a better job of documenting when we are and how we are actually changing decision making to really make the case. You know, I'll try to cite a couple specific examples of where I'm seeing and I would like to do a better job of really documenting that impact. But I think that we have where they've been rolled out in Burkina Faso, which doesn't have a lot of background in cash for humanitarian response, cash approaches to humanitarian response, but where they have been rolled out in urban settings in particular, there's this very strong preference for cash over in-kind support. 65% of respondents in urban settings said that they want cash-based assistance. In contrast, there's a larger preference or a slightly marked preference for in-kind in more rural areas, in harder to access areas, and frankly in areas where humanitarian operations are ongoing. So I think that we are trying to use that feedback as part of the analysis to justify and to then impulse or to provide an impulsion for more cash-based programming to think about how we can do it in a more multi-sectoral approach and how we can do it broader. And just to note that, you know, that is tied in, for example, to the cash for food assistance work that we are doing with funding from the Central Emergency Response Fund via WFP and some broader partnerships that they have established. So that's perhaps one example that I could cite. It's hard to say that, you know, the community feedback is the determinative element, but it's certainly a contributing element. And I think that's an important emphasis to continue to push forward. Another one, and this is less about the collective approach, but more about how committed agencies can really become influential by listening to accountability feedback. We've got examples about communities basically saying, you can come, communities in very hard to reach areas, saying to their humanitarian partners, you can come. It would be best if you come on day X to avoid the market or to be there at the time of the market. These are the, you know, the transportation modalities or the transporters who can work in this area because they know the context. And also providing feedback on quality specifications for the assistance that they're going to receive to ensure that it doesn't make them a target. So, you know, some strong complementarities with security analysis and considerations, do no harm considerations, but that are built on community feedback about what they feel is appropriate to support response. And so I think that that's another concrete example of what we need to continue to build on. Turning towards the second question, if I can also be a bit provocative, take my shot at that one. You know, one of the things that I've observed and discussed with some partners, I won't name them, but they acknowledge the point, is that it feels in Burkina Faso that every organization, and in some cases, almost every program, has its own hotline. But, you know, are we actually even really hearing the information that's coming from those hotlines? And I have had discussions with a number of partners who have conveyed the what they feel is the practical impossibility of actually consolidating across hotlines and then being able to aggregate and use that data in an effective manner. It's one of the key challenges we are trying to tackle, but it's a big obstacle. And it's not helped by the fact that a lot of those hotlines are put in place because that's the AAP commitment, or that it's not the AAP commitment, that's the accountability commitment to the donor, because the donor has asked for there to be an AAP commitment, and this is kind of the minimum threshold. So I think we need to, rather than being concerned about how feedback changes targets we've promised to donors, we need to welcome feedback changing commitments we've made to donors, and to do that so that it's really making greater coherence come together in our approaches. Over.
Great, thanks, Kristen, and thanks for being provocative. Always welcome, and that's how we strive for change as a system. So maybe I'll direct the last question to Emanuele from IFRC. So Emanuele, we have high levels of satisfaction emerging in the evaluations that are being conducted. It also may be because we are not doing enough community engagement to begin with, and people don't feel comfortable speaking up. So in your view, what needs to be done to address perhaps two things? One is addressing some of the existing trust deficit within communities, and how can we ensure that there is better access to community feedback and complaints mechanisms? Over to you, please, Emanuele.
Thank you. Important question, and I think feedback mechanisms are very much cultural. They are cultural elements, they are language elements, they are literacy elements in it, but the critical element on responding is trust. And so who asks the question is important. And if you don't have trust in who's asking the question, you will not be inclined to give a truthful answer. And so for me, understanding at what level and how to engage is very important. From a Red Cross perspective, we work through volunteers that are selected within the communities where they come from, and they are trusted within those communities. Hence, the ability to ask questions and receive more truthful answers is clearly enhanced. That is different if you have a government official maybe coming in and asking questions directly. So I think, again, going contextualized, and it's extremely important in that way. And the other way is to make sure that whenever data are collected, then the feedback loop is closed with action taken. And that builds trust, because people see, oh, I've been listened to, people have acted. And I just wanted to give an example that for us was quite relevant. The Red Cross was very involved in Ebola, in safe and dignified burials of people who had been dying of Ebola. And it was extremely difficult at the beginning to get people to accept these people coming in, our volunteers coming in with the hazmat suit, into the hats, taking all the body out, taking the belongings out, burning the belongings, and going away and bury the person. And they were fighting. I mean, we had our volunteers also attacked, but there were the number of sessions, many around feedback, that allow us to understand that people thought that we were taking away the soul of the people and putting stones in the bag, and that allow us to change the way the bag was manufactured and have it transparent on top, so that people could actually look inside, that we were not taking away the body, we're not putting stones in it. We had fears that the people, the relatives, were not feeling close to the deceased, and then we changed our approach by putting one of the relatives at least to be in the hazmat suit and be able to be close to the dead body and accompany really until the last point. These are some simple examples that can change the way we operate. And I would say one last thing that we learned really in the ERC recently. Through the feedback monitoring systems, we knew that certain communities were not trusting their response, and we saw the lack of trust increasing over time. And when these reached the highest point is when we had attacks against facilities that led to the death of doctors and nurses that were working in that facility. That is also an issue. It is a tool that can help creating better safety also for the workers in highly, highly tense environment. And so there is an element, additional elements that can come. And if we, you can work on those tensions levels before you actually have moments. So that's once again why community engagement saves lives and is so important.
Great. Many thanks, Emanuele, and huge really thanks to all of the other panelists for making the time to be here, and most importantly for all of the colleagues that were able to join us today. Again, please do feel free to forward the recording of the session with colleagues that were not able to join today, but perhaps a couple of very quick concluding remarks. And I wanted to first thank the panelists before colleagues, hang up and run to the other meetings, because it's important to recognize the great interventions and the good responses that came from the panelists. So first is there's a lot of, as I was mentioning, there's a lot of good work happening within the system. We're all working towards the same objective. The ingredients for success in terms of achieving our collective responsibility to serve people in need are there. There are brilliant examples already on the ground in operations at the country level that we need to shed the spotlight on and scale up. And we are committed to make sure that we do more of that. In the world of the Interagency Standing Committee, there is a lot of critical building blocks that we are putting in place to make sure that we achieve this. Starting with, again, and it's huge thanks really to the co-chairmanship of UNICEF and UNHCR of the IASC Results Group on Accountability and Inclusion. They are currently developing a collective accountability and inclusion framework to set out the core commitments and building blocks for humanitarian coordinators and humanitarian country teams. This will help HCs and HCTs to better implement collective AAP and be held accountable for doing so by setting out key actions that they will be devising themselves that are needed throughout the humanitarian program cycle, and look at metrics for success. Results Group 2 in the IASC is also working on developing a critical tool. We talked a lot about, again, Oliver, you're mentioning monitoring and evaluation, measuring progress. So there is an IASC results tracker that is being developed under the auspices of Results Group 2 within the IASC, and it's with huge thanks to CHS Alliance that is really leading the charge and the consultations within the community on developing this results tracker to monitor collective accountability and inclusion, and it will provide a strong roadmap on the minimum required steps and should be adopted as a standard. Again, between the accountability framework and the action plan that will be devised by HCs and HCTs, inshallah, as well as, again, the results tracker to look at the progress being made and the benchmarks systematically, we will be in a better place to make sure that we achieve on these AAP aspirations. A community feedback and complaints mechanisms, we didn't speak too much about it in today's session, and but again, obviously critical, fundamental, at the core of the response, full stop. And by having strong community feedback and complaints mechanism that are key ingredients of which is trust, as colleagues have mentioned on the panel. Key ingredient is trust, accessibility by communities, trust communities to use them, and the analysis of, again, that feedback that comes in a secure environment, channeling the feedback to the appropriate platforms, decision makers, and adjusting responses accordingly is fundamental, and is an area that also the Interagency Standing Committee, through the work of the Results Group 2, is looking at. Last but not least, there is a service directory and AAP portal that was launched several weeks ago, with thanks again to RG2 in the IASC. The link will be put in the place in the chat box shortly. Take advantage of it. Great resources that will help us as a community to make sure that we deliver on our AAP commitments and aspirations. Again, huge thanks. Many more discussions to come, and I hope the next discussion will talk about, again, some of the good progress that we're able to make in this really fundamental aspects of the work that we do. Thanks so much again, colleagues, for a great session.